My name is Dr. Spencer Ritenour, and I'm a remote optometrist for Access Eye Care Services. I live in Portland, Oregon in the Pacific Northwest. Currently, I see remote care patients in Utah, Idaho, and Iowa. There are two main reasons why I wanted to pursue remote care as a career option. Number one was stress. My stress levels are a fraction of what they were when I was in office. Number two is a more dynamic and flexible career. Healthcare is changing by the month, it seems like. The country's changing, the world is changing. And I wanted to be able to adapt as new technologies come, as what we call the exam process. I wanted to be flexible, not stuck in a rigid model at a location simply a few miles from my home. With remote care, much of the exam process is the same as what we're used to in a traditional on-site clinic. There obviously are a few differences. Pre-testing is done in a similar fashion, but all the results get digitized, and I see them here embedded in our programs. The patient moves into the exam room, and I pick up the patient and I greet them just like normal. Inside that exam room, there is an assistant. They help me with entrance tests. They help me arrange equipment in front of the patient, etc. I monitor all those via live video. And then as far as refraction, that's always a big question. I control the phoropter remotely. So I control the phoropter with my mouse. I have a very elaborate control panel on my screen. Then we check the patient's health, just like we would do in the clinic. To do this, we have still photos. We have recorded video. We have images of the retina. We have live video and other tests that we can do. Before I started with remote care, one fear I had was I'm not going to fully be able to take care of the patient to meet their needs. And I've been pleasantly surprised that that is not the case. In most cases, we can take care of their needs fully. There are a few that perhaps remote is not the most appropriate solution, but there's methods to get them to the proper care that they need, whether it's an on-site doctor down the hallway, whether it's a doctor in an office in the next town over, or even a private practice doctor or an ophthalmologist. That's built into the system, and that's done well by design. When patients get an exam via remote medicine, their expectations are generally greatly exceeded. Today, we're used to having very sanitized digital information. Our smartwatches tell us in incredible detail about our heart rate. We can count our steps. We can track all our information on patient charts from the hospital or your local primary care doctor. When they get an exam via this mode, optometry is now to that level. It is now to modern standards, and they have great confidence. They have great confidence that their data is well preserved. When they see an image of their eye, it's no longer just a sloppily written note in a chart. It is very explicit and it is very clear, and they take a lot of trust and a lot of faith in that. I'm able to greatly teach the patient and show them why their eye is sick, or even why they're healthy. Like, look, this is the reason why you're healthy. This is where things can go wrong, and they're not. They look fabulous.